Hello, how are you? I'm Dr. Alexandre Mota, and in today's video, we're going to continue talking about feet, about that burning sensation, that uncomfortable pain on the sole of the foot. There's a very simple, very practical way for us to help the nerve that carries sensation from the sole of the foot to our brain work better. So look at the foot. The sensations of pain and burning here on the sole of the foot often come through a nerve called the tibial nerve. It comes here along the inside of the foot, passes behind the malleolus, that little ankle bone, and goes to the foot. So, sensation from the sole of the foot reaches our brain through the posterior tibial nerve. The tibial nerve. To find the spot where we're going to work, do the following. Tá? First thing, find the little bone on the inside of your ankle, the malleolus, okay? And for some people, it's very easy to notice. For others, not so much. But as soon as you start to touch and feel, you'll quickly notice there's a little bump, a big bone bump. And then in this part here is the medial malleolus, calcanhar. The other reference point we're going to use is the heel, which is easy for us to see and to feel. All right? So the heel, between these two bones, between these two reference points, passes o nervo, the tibial nerve, the posterior tibial nerve or tibial nerve. That's right. The big problem is that connecting the calcaneus to the malleolus, there's a structure there called the retinaculum, which can trap it and compress it. This nerve, okay, especially because under the retinaculum, through this tunnel, not only the nerve passes, but also several muscle tendons, right? And the structure that we are going to release, that we are going to improve, is exactly the retinaculum. And this way we help the tibial nerve pass through this region. What are you going to do with 3 fingers? You're going to stick them to the skin, and first you're going to do a quick little massage. Look, forward, backward, as if you were warming up to heat up the tissue. Okay? Then the other direction towards the calcaneus malleolus. And finally, you're going to do the following. Rotate clockwise, hold for 1.5 minutes, release, rotate counterclockwise, and hold for 1.5 minutes. Pay attention, my hand doesn't slip on the skin, okay? It sticks to the skin and moves the skin clockwise for 1.5 minutes, releases, sticks to the skin, moves the skin clockwise for 1.5 minutes. Another thing that can really help here is improving heel movement. All right, so look, hold the ankle with one hand, the other hand wraps around the heel pad, and you're going to move it. You can make a cross going inward, outward, then upward, downward, and you can make circles. Do it about 30 times in one direction and 30 times in the other. See how this affects the retinaculum and how the nerve passes through. Look, and this is on the outside, okay? Imagine inside where the movement is much greater. After you do the direct release and improve the movement of your heel, leave a comment if this relieved your pain or not. The burning in your foot. Let me ask you one more thing. If someone came to mind who has pain, burning here, or complains about some problem in their foot, send this video to them, do me a favor. You can really help improve that person's quality of life. I'll stop here. A big hug, and see you next time. So, what do you think? Left a comment there. Alright, if you remembered someone who has foot pain, please send this video to them. Stop sending that other one. My God, I'm having a hard time speaking. So, have you already left a comment here saying if it helped or not? If you haven't, go ahead, I'll wait.